Hello, Dr. Vicki Peterson here. I had two interesting emails come my way recently and I wanted to discuss them with you. They're probably going to sound very disrelated, but I'm going to tie it together. So one was a report from the BBC, the British Broadcasting Corporation, having to do with GlaxoSmithKline. They're a huge pharmaceutical company worldwide. They're actually a British company, but what the article was about was a recent lawsuit that they had, which was here in the U.S., and they were fined $3 billion, which is the largest settlement with such a company in history. And the reason they had to pay that money was twofold. One, they promoted the use of antidepressants to children and adolescents when these are not the recommended use for them. In fact, we know that indications of wanting to commit suicide, having suicidal thoughts, are associated with giving antidepressants to children and adolescents, which is why it's not recommended. So they were promoting the use of that with their antidepressant drugs, which obviously is extremely dangerous. And also what came out is their diabetes drug called Avandia, that what they were promoting about that was the safety benefits while downplaying the negative side effects. And what has come out about Avandia is that it is known to cause heart attacks and heart failure. So, not a small side effect. And actually indications of this, I did a little research, indications of this were kind of in the air back in 2010, so 2 years ago, but it was suppressed by the company. They cited a study that they did on 50,000 people showing no problem, and so what came out was that they actually paid the researchers to suppress this information. Now, if you've never heard stories like this before, you will be shocked. I think it's always shocking to hear them, but it's not new. These types of stories have come out about a lot of different drug companies. Now, in addition to those two issues, what also came out was that GlaxoSmithKline bribed doctors to utilize their drugs. And so they would give them entertainment, free trips to Hawaii was an example that was cited. Also, they paid doctors millions of dollars to go on speaking engagements and promote their drugs. Once again, this is not unusual. It's not ethical, but it's not new. But once again, if you haven't heard about it, you might be a little shocked. So if you think about the fact that your doctor might be prescribing a medication for you so that he can win a trip to Hawaii, what do you do with that? You know, it's extremely disheartening. And when you also think about the fact that in our country, the FDA, the Food and Drug Administration, I mean, when they give their check mark of, you know, FDA approved, most Americans sit back and go, okay, it's good, it's fine, I don't need to worry about it. As a matter of fact, we use the contrary. Well, the FDA hasn't approved this, you know, it's a vitamin, so you should be very cautious. You hear stories like that. Well, vitamins don't kill people, and the fact that you can get FDA approval by lying to them and paying researchers is obviously a huge problem that really needs to be dealt with. So that was email number one, was learning about this suit. And email number two was from a woman who wrote to me because her husband suffered from seizures, and her son had done some research online and found one of the blogs that I had written about the connection between gluten intolerance and seizures, and based on that they decided as a family to put her husband on a gluten-free diet. Did so, saw a dramatic improvement in his seizures, and the reason she was writing is that when she asked her husband's neurologist about this and could he look into it and perhaps do some testing and really confirm or deny if this really was an issue, having her husband be gluten intolerant, the doctor's statement was, as a doctor I work with drugs, I don't work with food. And that was the end of that statement. So when you put these two moments together, what are you confronted with? We're confronted that we're in a society, a healthcare society, that feels that drugs are the only answer. They don't get to the root cause. They tend to mask symptoms. They have side effects. We all know that. They tend to have worsening side effects the more we know about them because of this underlying unethical behavior by researchers and pharmaceutical companies to suppress the negative aspects of their drugs and to embellish the benefits of them. And we refuse to look at diet, which more and more information is coming out to support the fact that it's truly impossible to be healthy on what we call the standard American diet, or SAD, and it is SAD, because we have high fructose corn syrup, and we have trans fats, and we have artificial sweeteners and artificial colors and preservatives. We don't eat real food. You put all this together, and you then no longer have to wonder why we are absolutely losing the battle on heart disease, cancer, diabetes, and obesity. It is no longer a question as to why we're not winning those wars. We are thinking and acting like drugs are the answer when they're absolutely not. So my purpose in this video today was to bring some facts to light. I will include some studies in the description today so you can have some interesting information. There's been some amazing studies out on how diet alone can reverse diabetes, absolutely reverse it in a matter of weeks. These studies do not get a lot of press because, once again, we prefer Avandia, which causes heart failure. That was a little cynical, I'm sorry. But I'm a little frustrated, to be honest, if you haven't noticed. You need to find a clinician who understands getting to the root cause. You need to find a clinician who understands and appreciates the value of food and diet. You need to find a clinician who understands that pharmaceutical drugs are temporary. These three things, if you can find a clinician that understands that, you will be on the right road to regaining health. And I appreciate the fact that there's not a lot of us doing that. I truly do. And so I'm not saying it lightly, but if we demand it more and ask for it more, it will be created. It's a journey. It's definitely a journey to get healthy. It's a journey to maintain health. And I just want to let you know I'm here for you. Please write to me. Let me know how you're doing. Let me know how I can help you. And until next time, I wish you very good health.